Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about the importance of wound care in the clinical home care services available at the VNA. So with us today we have Susan Flynn, who is the CWOCN team leader, and Kathy Rowe, Manager of Specialty Programs at the VNA. So thank you both for being here. I appreciate your time.
My pleasure. Yes.
Then just to get started, I always like to at least get the viewers to know you a little bit. So I'll start with you, Sue. And how long have you been in home care? And did wound care come right away, or?
Actually, I've been with the visiting nurses. It'll be my 20th year this coming year.
Well, congratulations to you.
Thank you, and I've loved it. And I didn't start out as a wound ostomy nurse. I started as just a nurse in the field, a case manager, and I was a provisit. And at one point, it became evident that we needed to have wound ostomy nurses, more of them. We only had 2 in the agency. So I was approached and asked if I would be interested, and I said, sure.
Oh, yeah.
So off I went to school, and that was 8 years ago.
Wow.
8 years ago.
See, time flies when you're having fun. Right?
Yes.
Right?
Yes.
Right. What about you, Kathy?
Well, I've been in home care for about 20 years.
Okay.
But it hasn't been here on Cape Cod. I've been across the country in the Chicago area and in South Eastern Mass also. And I've also done teaching at 2 universities. So home care was something that came afterwards.
Yeah. So how long have you been with the VNA?
I've been with the VNA a little over 6 years now.
Oh, yeah.
Yeah.
See? And Susan, you were just saying only 2, at one time there were only 2 wound care nurses, and it's a large organization.
Yes.
So of the, I don't know, we have 250 nurses out there in the field.
300 plus nurses in the field.
Oh, very good.
Yes.
Yeah.
We now have 7 WOCNs in the field, which is a really incredible amount of specialty people, because there are places in Boston that have, 1 for a huge area. So,
is that right?
Yeah, so we're really fortunate to have this many.
Yeah.
Mm-hmm.
So for viewers, we'll just start them out with some of the basics of when we talk about wound care or WOCN, what does that stand for?
The initials WOCN stand for Wound, Ostomy, and Continence Nursing.
Okay.
Okay, there's 3 different types of nursing going on within this special field. And in order to become a WOCN, you go away for 8 or 9 weeks, depending on which school you go to learn about each field. And then you have to pass tests in each area to become certified.
Okay.
So it's very specialized and it's very difficult. And they don't offer a lot of schooling. So across the nation, there are not a lot of WOCNs.
Oh, yeah. So where did you school?
I went to the University of Texas in Houston,
Oh, wow.
Houston, Texas.
And was it 8 weeks straight or 2 weeks on?
No,
2 weeks off,
8 weeks straight, 5 days a week.
Wow.
8 to 6 every night.
Wow. And then they take you through each one of those? You do wound, you do ostomy?
Yeah, you have a
do
month's worth of class time and then a month of going around to the various facilities and observing other WOCNs doing their job in hospitals, in home care settings, clinics.
Oh, yeah. Yeah, so you get a real hands-on experience with it. So do we know why the agency sort of made that decision to dedicate so many nurses specific to wound care? Is it the market that we serve, that our patient list is that?
I'm not sure with that. I know that we do have a huge percentage of our patients do have wounds, so it really helps us to be able to go out there, to be able to educate our patients on how to do their wound care, and for us to then come in once or twice a week in order to make sure that everything is going well.
Okay, all right. The certification, once you have it, do you need to then have a tune-up or a recertification, or how do we know that you're staying up to speed?
Well, we, as nurses in general, we have to take so many continuing education courses to maintain our registered nurse status. So we still have to do that. So now we basically take all of our classes related to wounds, ostomy, and continence.
Okay.
We go to an annual conference for 2 days every year, and sometimes there are other conferences we attend as well. And then the Board of Certified Nursing has decided that they need to make us take the exams every 5 years. Aren't we special?
That's the best part, right?
That's the best part, yeah. That's great.
Because everybody loves exams.
Right,
Yeah.
exactly.
Yeah.
So,
Okay.
so that makes us stay current and keep reading. And we network with other WOCNs at our conferences. We network with each other. We're all seasoned nurses at this stage, and so we have a lot of knowledge between us
Right.
that we share. We love to share.
Is that a requirement that there be so many years of practice as a nurse before one goes on to get
you have
certified?
to,
Or
no, you have to have your Bachelor of Science in Nursing.
Okay.
Because it's an accelerated program. It's actually a master's level program that they put you through. The pace is so intense
Yeah.
that you really have to be able to read. I read 4 textbooks in 4 weeks.
In that time period.
Yeah, so you have to be able to do that.
Wow.
Yeah.
So back to the WOCN piece of it. So for viewers that maybe have had wounds or home care services, when would they see you and your team? And if we go into the wound or the ostomy or the continence piece?
We generally see patients when they have more complex or complicated wounds. If someone has a basic skin tear, you know, a simple little skin tear on their hand, it doesn't really require a WOCN to come out, because hopefully that skin tear would heal very quickly, you know, 2 to 3 weeks, and the wound should be healed.
Okay.
We're more inclined to go see people that have complicated wounds, arterial wounds, venous stasis ulcers,
Okay, wait a minute.
diabetic wounds.
So will people know? So arterial would be,
Lack of oxygen to the limbs, and so
they've had an injury and it's just having
and then
trouble?
it's not
Okay.
healing, right?
Okay.
Venous stasis ulcers occur with people that get a diagnosis of venous insufficiency. The leg pumps don't work well enough to get the blood back up, and so then they get edema, swelling of the leg.
Okay.
And then they end up, if they bump or anything, they end up with a wound, and then it can become an ugly wound and a long time healing wound.
Oh, it's a slow healer,
It's a slow
so
healing
those
wound.
trickier
It's
wounds.
trickier to,
Yep.
to figure out. So then that's where we would come into play to try to heal the wound. The same for the diabetic wound. Those wounds are longer to heal because of a lot of different factors that affect the wound healing.
Is it a lot of legs, because that's just as time goes on, that's a slower circulatory area? And
For the venous insufficiency?
Yeah.
It hits people that have been standing for long periods
Oh,
of
yeah.
time. Unfortunately, it affects more women than men. And think
Yeah.
about our jobs. We're cashiers and teachers and
Yeah.
hairdressers and people that are on their feet. So
Ah,
I think
interesting,
the
yeah.
valves don't work as well in the legs, and you get congestion
Okay.
in your legs.
Yeah. Oh.
Yeah.
Okay. How about ostomy?
Ostomy, and the ostomy nurses at our agency, we love our ostomy patients. We love our wound patients too, and our continent patients. But the ostomy patients, for us, it's so rewarding when we can take someone from a brand new ostomy and they're just so fearful from having had this surgery, and it's difficult, and there's so many changes that go with it. And so we help them. We go in at the beginning, we get them oriented to having this new body image, and
Can we go? I'm just going to back up a little. I'm thinking again of viewers that might not even know. So, what is an ostomy? And
an ostomy. Okay, an ostomy is an opening made by a surgical procedure through the abdomen that brings out a piece of bowel that then is sort of sutured. It's tucked. They fold it in on itself and they tuck it in, and they divert a piece of the colon so that they can rest the colon for various reasons. And there are temporary ostomies and there are permanent
okay.
ostomies. And for the people that have temporary ostomies, the most likely diagnosis is diverticulitis,
okay.
which is an inflamed sac in the bowel that ruptures and causes havoc.
Okay.
So we would then go in and help that person deal with having to wear the ostomy appliance and just get back to living.
Oh, yeah.
And understanding that it really does not wreck their life.
Oh, yeah.
Yeah.
Because they must have that feeling
They do
after
have
some
that
kind of
feeling.
surgery like that.
Yeah, they do. It's very difficult.
Do you have equal men and women? Or is
Yeah,
it,
I don't think there's so much of a distinction between men and women there.
Yeah. Okay, so you had mentioned, I know they're not your favorites, but because it's such a fearful or body image thing, that to have you go in has greater meaning.
It
for
does.
people.
Those people really appreciate the fact that we have so much knowledge to be able to help them through this very scary time in their life.
Yeah.
And we have found that we make our biggest impact on people that have ostomies. I mean, it's great that we can heal wounds as well.
Yeah.
And that's a big impact too, to not have to have a daily dressing anymore. But I think the ostomates really appreciate
Right.
the extra knowledge that we have.
Right. Now, what about continence then? That's the
Continence
third.
is the third area, and it is a huge area. It's the #1 reason people are placed in nursing homes, because the family members or caregivers can't handle the level of incontinence. So in that case, we try to go in and we try to help with toileting programs to make people that are maybe incontinent during the day, continent during the day, so that then the caregivers' jobs are easier and then they don't get placed in nursing homes.
Right, right.
So that's our job. As visiting nurses, I think Kathy would agree, we want to keep people at home.
Right.
That's our job.
Right.
Our job is to keep you at home.
So the success of the program can almost be pointed to how many get to stay at home.
Right.
Yeah. Now, and maybe Kathy, you can help address this one, but does the team do all the work? Or do you teach patients some self-care, or you teach family members? Or
Our goal is really to teach patients how to take care of their wounds, but also one of the things Susan did talk about was the diabetic wounds, and I think it's important for our viewers to understand that we have to look at what the underlying cause is. So like when Susan talked about the diabetic wound, the diabetes is the underlying cause, and so what we try to do is to work with patients to keep their blood sugars in control, and we may have to use our diabetic educator that would need to come out. We want to use her to go out to work with those patients. The venous insufficiency patients that Susan also addressed, I mean, we really want to get the patients to get rid of that fluid, so we really have to have work on making them, wear special stockings or sometimes ACE wraps for a period of time, or elevate those legs, so that we work with the underlying cause so that they won't get those wounds. Not only will they heal faster, but then to try and prevent them from reoccurring again.
so do you find patients are good about embracing being educated or bringing in other tools?
I don't think that they always make the connection.
Oh, yeah.
And so I think that's what our job is to do, is to make the connection, to have them understand what causes the wound or what prevents it from healing faster. And so in that way, we can get them to understand and to control the pieces that they can control with, and not just looking at it as an isolated situation. The
It's
wound.
not connected to anything else going on in
Correct.
their lives.
Yeah.
Yeah. Then, does this also happen with the family members or caregivers, or is it pretty much one-on-one with the patient?
No, we try to involve the family as much as possible.
Okay.
Because really, this is their loved one, and their illness is about them, but it also encompasses the family dynamics. And so the teaching of, if they have someone going shopping for them and they're just buying them soups full of sodium, it's not going to help the swelling to go away. So you have to educate them to be making better purchases for what they're eating, and it's vast, the amount of teaching that goes with the territory.
I know that, because I've seen you with bags of just the tools and the technology that's available for all of these services. I'm thinking about an ostomy, for example, because I've heard stories of people having one for years and years, not even realizing the technology has been updated, and how much better can you make their life just by some of the new technologies.
It's true. We have people here on the Cape that have just discovered that we exist. They've had an ostomy for 18 years, and they're in some sort of archaic appliance, and then we bring them in and say, look, this is what we can offer you. We're going to take you from a Volkswagen to a Mercedes.
Yeah.
And they're very happy when they
bet.
can find that there's something that's just, I mean, like technology is just upgrading everything today. It's happening in this world as well.
So that's what I wonder then, how do you keep up with all of that? Is that some of the meetings that you have?
Yes.
Or
We have sales reps from all the different companies, and
Okay.
they come throughout the year and show us what's new and different in what they've been marketing and manufacturing. And so they often use us as guinea pigs. Here,
Oh,
take
yeah.
some of this product and
Yeah.
try it out.
Yeah.
So we do, and then we get back to them and tell them whether or not we like it or we don't.
Right. Now, do you communicate with the physician during all of this, or do physicians normally say, hey, I know you're the wound care experts?
Well, absolutely, we involve the physicians. I mean, it's their patients. We're there to help. We're an adjunct to their care. We're often the eyes in the field during the wound progress. They might not be getting to their physician as frequently, so we update.
Okay.
We update the doctors and let them know that the wound is healing or it's not healing, and we'd like to change the wound care based on what we're seeing. So the physicians are very involved.
Okay. Does the patient, I'm back to some of the wound care or ostomy experience, actually do some of their own dressing change?
Absolutely.
Are they all willing and able, or some are?
I think
Embrace
at
it.
first it can be overwhelming to them, particularly depending on their situation.
Yeah.
If they've just come home from being in a long hospital stay or whatever.
Yeah.
But I think as time goes on, we continue to work with them to show them that they can do it themselves, or a family member could do it for them.
And then where do they get the supplies once say they're on board with this, and then we only have to check in occasionally to make sure it's all going well? Are they down at CVS buying stuff, or
No,
this
we
is
order the
specialty?
supplies. We order the supplies for them. That's
Okay.
part of them being, for most of them on VNA.
Okay.
that if they have Medicare, it depends mostly on their insurance, obviously, but we will work with them and work with their insurance company to get them the correct supplies that they
Okay.
need. And they get them delivered right to their home.
That's nice. So that's less worry for the patient to
Right.
know that they have the right stuff at the right time, and they know how to use it.
Right. And a lot of people come around very nicely to at first thinking, well, I could never do that. And then they do it.
Is
and,
that right?
and they do a nice job with it.
Yeah.
And we let them know that you can do this.
Oh, yeah.
So it's a progression.
Yes. They must feel empowered and much more confident about being part of their health care.
Yes.
When they're able to do something like that.
Absolutely.
Yeah. Now, how often do you visit?
Depends on the wound, it depends on the ostomy. With the continence, we can usually set a program in place and then just check back with the caregiver to see how it's going. Ostomies, anywhere from 2 to 3 times a week initially to get over the fear of using the equipment. And then the wound really is driven by the physician's orders, how much the wound is draining, and what type of products we're using.
Okay.
So there's 3 different things that play with. So it could
So-
be twice a day to twice a week.
Okay.
Or once a week.
So any viewer that has either had the experience or is anticipating it, the expectation is everybody's different, and it will depend
Exactly.
on the individual.
It does. It depends on how they heal. All those factors we talked about,
Yeah.
nutrition, oxygen, circulation, all of those things come into play
Yep.
with how the wound is going to heal.
Okay. Now, we have a new process. I understand that there's a photo option available for
Yep.
keeping an eye on the wound. And can you talk a little bit about how this works and how has it changed your work?
Well, first of all, the WOCN, the Certified Wound Nurses, they do act as consultants to our case managers or nurses out in the field, so that the wound nurses are cared for by our our clinicians in the field. And then we'll have the wound nurses come in, they'll be referred in, and they'll take a look at the wound and see if there's something that could be done better or a different product, and collaborate with the physician on that. And so what we've put in place is that with the case managers who are actually managing the patient can take a picture of this wound, and also the wound nurses could take a picture using their cell phone, which they would normally use, and they're able to download it right onto their computer in the home, or right afterwards, because we want them to put it right into that patient's record immediately, and that they can do that right away, and that way they can keep track of what does the wound look like at the beginning, and then every so many weeks as it progresses. And if they needed to reconsult with the wound nurse again, then the wound nurses could easily take a look at that photograph.
Okay, so the process is more, the wound nurse gets everything set up, identifies what the needs are, but we have so many clinicians out in the field that they just continue with whatever those recommendations are, which includes now being able to photograph and send it in if there are any questions, or just, is it a standard now that you take a shot and just keep it in the file so you can watch the progression, or only if it's a question?
I think, again, we base it on whoever's looking at the wound, how complicated the wound looks, and if it's worthy. Again, we're not going to photograph skin tears.
Okay.
Unless it's a really humdinger, then we would.
Yeah.
But,
just for sharing and education. Yeah. Did you see this one?
Yeah. But no, basically, if it's a simple wound, we don't photograph. If it's complex, we photograph.
Okay. Now, there are a lot of different home care agencies out there. Do all home care agencies have this level of staffing and certification for wound care that you're aware of?
No.
So that's
We're pretty
good
lucky.
for people to know that they're very lucky, to have this many specialized in this particular field. Right. Now, the VNA has free ostomy clinics.
Yes.
Yay.
Yay. Wonderful.
So maybe viewers would like to hear a little bit about that.
We offer 3 clinics a month, the first, second, and fourth Wednesdays, so it stays the same. The first Wednesday's in the Falmouth office, and the second and fourth Wednesdays are in the dentist's office from 8 in the morning to 12. We have a certified ostomy nurse there who will just do a tune-up, or just check, or answer questions, or evaluate the equipment, whatever, and it's wonderful.
Do you have a lot of people that take advantage?
We do.
Yeah.
We do.
Do
The
they need
clinics
to
are
make an
usually
appointment?
running full. They just call our referral intake department and just say they would like to visit on this date, and an ostomy nurse will call them back and give them a time, or work with them to get the best time.
Okay. Now, we've had some success stories through that program of people that show up. I think it was the example of, and they've had the same appliance for 18 years.
We do. We see people that have not seen an ostomy nurse for years or ever.
Yeah.
Yeah.
And we've had physicians, I think, refer into the clinics, which is a sort of a testament, I think, to the quality of the work that's done there.
Right.
Good. Now, this is my own little sidebar, and I'm thinking viewers might be curious too. When people have an ostomy, and we talk about the lifestyle changes that it brings, can they still swim and do other activities?
Absolutely.
All right.
They can
I've
do.
heard that
They
at the
can do
Y.
everything that they did before, with the exception of weightlifting. You can't bench press.
Okay.
Because it puts too much pressure on your abdomen and can give you a hernia. So pretty much everything else is a full go.
Yeah.
Yeah, they can play sports, everything.
Is that a question that you get from people new?
All the time.
Yeah.
Yeah. Well, you worry that it's going to affect your lifestyle in such a way that you're not going to be able to do anything. And, we've helped people that have never left their house before get out of the house.
Wow.
Yeah, it's really, that's what I mean, it's huge.
Yeah.
It's huge.
Yeah. Well, we only have about 2 minutes left. So I wonder if there's anything that we haven't covered, or final thoughts that you'd like to share with viewers about, can they call, or?
One of the things that I just wanted to clarify is that an ostomy doesn't always mean just a bowel diverging. It could also be that urine could be
Okay.
It's so that some patients have surgery where they have to wear a same kind of an appliance, or it's a little bit.
Welcome to VNA Health Highlights, a program of the Visiting Nurse Association of Cape Cod. I'm Jeanne Sarnosky, and on today's program we're going to learn a little bit more about the importance of wound care in the clinical home care services available at the VNA. So with us today we have Susan Flynn, who is the CWOCN team leader, and Kathy Rowe, Manager of Specialty Programs at the VNA. So thank you both for being here. I appreciate your time.
My pleasure.
Yes.
Then just to get started, I always like to at least get the viewers to know you a little bit. So I'll start with you, Sue. And how long have you been in home care? And did wound care come right away, or?
Actually, I've been with the visiting nurses. It'll be my 20th year this coming year.
Well, congratulations to you.
Thank you, and I've loved it. And I didn't start out as a wound ostomy nurse. I started as just a nurse in the field, a case manager.